So I'm Dr. Megan Miller. You can all call me Megan. And I was going to be in town anyway for the peak training, and because Steven and Sharon and Jason are so amazing, we talked about doing a little group training with you all today. So first I just want to go around and introduce ourselves just so we all kind of know each other a little bit better, and then we'll dive into the actual training. Does that sound good? Okay. So I'm originally from Ohio, and I always like to say that from the beginning because otherwise you'll just sit here wondering, like, what is her accent? Where is she from? So I'm from the Cleveland area. Nobody else talks like this that I'm friends with. I don't know, it's just how I talk. And I originally was trained, did my internship at the Cleveland Clinic Center for Autism in undergrad, using more like behavior mod type things, but they call it behavior analysis. And I did my master's at Florida State, my PhD at Ohio State in special education, but everything else is psychology, my background. And now I live in St. Petersburg, Florida, and I used to own a business in Virginia called Navigation Behavioral Consulting, which is on the screen there. But now I didn't like being a business owner. Just like, there was a lot of stuff I didn't like dealing with. So I am the Director of Outreach and Development, so I get to do fun trainings and remote supervision and consultation there. And then I also run the peak stuff, so you'll see that tomorrow. That's a separate thing with Dr. Dixon. And then I work for Florida State part-time as well, doing research. So like once or twice a month, I get to play with little 14 to like 22-month-old little ones, doing ADOS assessments in the Mullen and the Vineland for a research project that they do for early screening for autism diagnosis. So I get kind of a mixture of all of the things, and it's really fun. So my background is mostly autism and in-home intervention, and I know obviously that clinical services here is like a lot broader, right? So for what you all do, you're out in the community, you're working with adults and like different populations. So a lot of examples I'll give are going to be more based around my history, of course, but hopefully you all can share your own examples and then we can kind of work through some ideas there too. Does that sound good? Okay. You get to go first. You don't have to talk for as long as I did.
You don't want the whole story then?
Where were you born?
I'm Ashley Ratliff. I am a BCBA with the Lexington team, so I'm the Associate Clinical Supervisor in Lexington.
That's the first time I've heard you use that title officially. Like you said it. I'm so excited. It's a new title.
She said it yesterday.
Oh, nice.
I'm Diane Hyman. I'm the Associate Clinical Director here at CPA.
Okay.
I'm Vicki Roberts. I am.
Is that new?
That is.
It's weird to say. And I'm a senior BCBA in Louisville.
Okay.
CPA.
I'm Raya Huffman, I'm a senior BCBA in Lexington.
I'm Shannon. True. The Executive Program Director for San Diego. Go ahead.
I'm Josie Berner. I'm a senior BCBA here in Louisville.
I'm Megan Durbin. I'm a clinical supervisor at Louisville.
I'm Sable Doucette. I am a clinical supervisor in Louisville.
I'm Jacob Howell, clinical supervisor at Lexington.
Okay, perfect. I should have had you guys all go around and say Louisville and see if there were like different pronunciations of it. All right, so this is the schedule for today. We're focusing on supervision and training for just based on some of the things that I encounter when I'm working with our leadership at Navigation. So some of this, most of it might just be a nice review and just like, oh, these are things I need to remember to think about that you've already known before. And then some of it might be new information, but I'm hoping that we can have some interaction and just really kind of do examples of things and practice applying what we're talking about and just get a lot of that happening so that when you leave, it's not just like, oh, Megan came in and said all this crap I already knew. So we're going to talk about types of supervisors and trainers. I'm going to go over, hopefully we'll do some like role playing and supervision examples. And then I'll talk about how I typically do training when we're working on training either staff or parents on like whatever goals are in place and what that looks like. And then we'll finish with some resources and recommendations if you're in a leadership position, which you all are. What could you study and learn more about to do a really great job at being collaborative and helping to coach people? Because there's things outside of behavior analysis that we don't typically learn about in our graduate programs, but I've had exposure to with some of my different jobs. And even for myself, like I have lists of, I need to read more about that, and I just haven't had time. But still, it's good to know that these things are out there, so if that is an area that you're wanting to expand upon, you'll have some resources to seek out afterwards. So, first we'll talk about types of supervisors and trainers. The content on the next few slides I initially made for a supervision training that we have on our website for navigation. So it might seem more geared towards if you're supervising someone becoming a BCBA, but it really applies to any situation where you're expected to train someone how to do something. So the first thing is, over the 15 years that I've been working in the field, I tend to encounter situations, fortunately, I've been doing remote supervision since probably 2009, 2010. So I get people that come to me who have had supervisors that weren't very good. So I get these multiple exemplars of bad supervision. And I've basically been able to categorize the two types of supervisors into rigid adherence or hands-off, and we'll talk about what that means. And then the one that we should all aspire to be is more of the apprentice, I'm gonna help lead and show you and give you an opportunity to perform and then give you feedback on that. So obviously with the work that you all are doing, you are in the apprentice style, I'm sure, based on what I've talked to you about. But sometimes, because of our own histories, we kind of might start to slide into one of the other types of supervisors. So it's just good to kind of think about what are those different types of trainers and supervision that we could provide and help be as close to the apprentice as often as possible, as opposed to the hands-off or rigid. So for rigid adherence, the first thing is that typically just focuses on duplicating. It's like a brain dump. This is exactly what I would do, now you do it too. So I've had people come to me and they'll say, they're doing a discrete trial program. Well, my supervisor that I have in Montana says I have to do 10 trials in a row with 10 mass trials and then 10 random rotation trials. And they have a very specific, boop, 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 this is what you have to do. And I'm like, what? How is that individualized for the child? That doesn't make any sense. And I'll say, well, for this particular case and what you're talking about, this data collection would be better. And they're like, nope, my supervisor says this is the only way we collect data. And I'm just like, well, that's not very behavior analytic, now is it? So that's the biggest example of rigid adherence. There's some way you learned how to do something, and whether you're meaning to or not, you might not even be aware of it, but just anytime that problem comes up, you're like, oh, this is what we do for that. Instead of individualizing, okay, I've worked on this before, and in that case we did these things, but for this child or this adult right now, in this environment with these staff or these parents, what really would work best? And kind of going through that whole problem-solving procedure. A lot of the times we're so busy, it's easy to just be like, here, let me knock all of these out, when really we need to sit down and really think about what's most effective in this specific situation. Does that make sense? Okay. There's oftentimes with rigid adherence a cookbook approach, so if you're using the BB map or the ABLES or any other assessment, it's just pull the next goal, pull the next program. I mean, I even know people that work at centers and whatnot where all they have to do is press print on the computer and the next program prints out for the kid, and there's no analysis whatsoever. So fortunately, with a lot of the community work you all do, that's not even possible right now, right? You can't just go to the computer and press print for community programs. But that is an issue that comes up a lot where people just, they have their database of programs, and instead of individualizing, they're just printing off the next one in the sequence. So we don't want to do that. And then, like I mentioned earlier, a lot of the times with rigid adherence, there's specific procedures that they focus on. So prompting, so we only do most to least, or we do, this specific prompting procedure with every new skill that we're teaching, instead of looking at, for the skill that we're teaching, what would be the best prompting. Reinforcement, they'll have specific schedules of reinforcement, and that's all they ever use. They don't actually analyze what would be best. And then, like I mentioned before, the data collection. So when people supervise in this manner or train people in this manner, that leads to missing skills for the people that they're training. What do you all think, what are some skills that would go missing if this was all you ever did when you were trying to train people? What would they fail to learn? Yeah, decision making for one, yep. pretty much the main one I have kind of broken it down. So like decision making relating to any of this stuff, right? So the multiple exemplar training would mean like when you're working with each different client, like having exposure to how to make those decisions with each of the clients and what do we do in these different situations. And you know, with anything, data collection, prompting, reinforcement, any of the different things where there's so many variables and so many options, if you're only ever doing one thing, you don't get those multiple examples to go off of. Skill assessment, especially I've worked with a lot of cases where it's like we only use the VB map and it's like, you're working with a 15-year-old. Explain that to me. Like, how is that working for you? And then program development, same thing. And then that analysis piece is really crucial. That really pulls in that decision-making part where it's like, if they're only ever just pulling stuff, there's never, you know, well, this could work, but then there would be this downside. So let's see about this thing and that, you know, kind of looking at what are all of the factors and how would that apply. But also the analysis of just the environment. So when I was trained in the field, the VB map and the ABLES, those were, well, the VB map wasn't available, the ABLES was, but at Florida State, we had a class where we like learned about the ABLES, but the bulk of our coursework there was on the science of behavior analysis, and we would just go like, we had to do a community project and it was like pick a problem and come up with a plan. You know, so we like go, oh, these people aren't stopping at the stop sign. What's something we could do for that? Why are they not stopping? You know, and they would just throw us out there and like, we didn't actually implement things, but just, you know, lots of practice with, here's a problem. What do you do about it? What do you need to further assess and analyze? With no like books to pull from or anything like that. You're just using what you know about the science of behavior. And unfortunately, that doesn't tend to happen as much in coursework nowadays. So it's our job as like the supervisors and the trainers to help give those examples to the people that we're training. And it's obviously really important for people we're training to become BCBAs, but even for like staff or parents, at a lower level, they don't have to memorize all our terms or anything like that, but helping them start to think analytically and behaviorally. That way, when they're in their natural environment and stuff just randomly happens, their initial reaction to things would be more in line with our science than, you know, a lay person who hasn't had any exposure to it. Do y'all have anything to add for rigid adherence? Have any of you ever experienced this type of supervision training? Yeah.
I think it lacks that generalization, right?
Mhm.
So then I think that's where we see a lot of BCBAs just freeze in the moment because this doesn't fit my textbook.
Mm-hmm.
It doesn't fit what my supervisor said at that one point, and now I don't know decision making. I don't know how to think through this anymore.
Yep. And we even have, like I've had issues even at navigation with people who are BCBAs that we've trained come to me and be like, well, I'm experiencing this problem. And I'm like, okay, so what do you need to, you know, and I feel sometimes kind of like a jerk, but I'm like, so be a behavior analyst and think about it. And when I ask, and sometimes I feel like it creates kind of like a learned helplessness or response effort. It's easier if I just ask you and then you'll do the thinking for me and I don't have to do anything kind of deal. So I get that every once in a while. I get an email from someone and they'll be like, oh my gosh, this thing happened today. And I'm like, okay, well, what do you think you should have done? Or why do you, why this or that? Or what would the science say? And I don't really give them an answer until they've like given me more. And then if they're not on the right track, I'll gently like help guide them or whatever. But if they're too used to this rigid adherence of people just constantly telling them what to do, they don't really develop that skill set to come up with stuff on their own. So on the opposite end of the spectrum is the hands-off type of supervisor or trainer. And with this situation, it's really just like the person comes in, they observe, they don't really give any feedback. It's just they might take some notes and maybe play on their phone, and then they sign off on the paperwork that needs to be filled out. And they'll have meetings with the people that they're training or supervising and really give very little feedback as well. It's just, again, let's check off the box, tell me how your clients are doing, I'll make some notes, and that's it. No direct instruction, so there's never really any like, let's sit down and practice this, thing. I think I saw two people upstairs when I first got here practicing some sort of yeah. So that kind of stuff never happens. But then there's this frustration where they might get upset that the person didn't learn something, but they never taught them the skill in the first place. So what skills could be missing if there's like never really any feedback, guidance, or training given? Yeah, that's exactly. Basically everything, right? Like, how would you learn? I mean, maybe they'll learn through some like random modeling or figuring it out on their own. This is the supervision I had, basically. So, and it wasn't even necessarily hands-off. It was in my first several jobs in the field, not like as a BCBA, but like working up in Ohio. You'd go into a home and they'd throw you some programs if you were lucky and some data sheets, and then you wouldn't see the person again. It was just like, here you go, here's your kid, do what you think you can do. And that was with like, I was an undergrad. I hadn't even graduated yet, right? So in the one sense, I guess I could add, if you have someone who takes initiative and is like, well, I need to do a good job, so I'll teach myself, then they'll probably learn a lot. But again, it's through trial and error, and not everyone is like that. If they're not shown what to do or how to do it, they'll just flounder and nobody makes progress, the child, the adult, the person that's supposed to be teaching. So this one is one that unfortunately we tend to slip into, again, because we get so busy. It's like we're finishing up a supervision session and oh crap, I have to be at this next place, so let me sign your paper real quick and I'll go over here, we'll talk about that later, kind of thing. So for me with this, there's a couple things I have to do to make sure I don't slip into this one, and one of them is not overschedule myself. So I get people that contact us a lot, and I do my own schedule and I take on my own caseload. So I have to be really good about, no, I'm full right now. Like, even if I look at my calendar and there are hours in the day that I could technically fit something in, knowing where my limits are and like balancing that. And then even if I have like an okay schedule, just making sure to give myself that cushion and scheduling in, whether it's as part of our supervision session, like making sure to give some extra padding there and like blocking out some time, or afterwards and some like paperwork type scheduling and blocking that off on my calendar to really be able to sit down. I do a lot of like video feedback because it's all remote, so like really be able to sit down, like watch those videos and take those notes and send them, you know, feedback on what they're doing. So I don't know how it works here. Do you all make your own schedules, or does CBA schedule you? Yeah. So any issues you run into that, like with kind of being able to fit everything in? Yeah.
Well, I'll speak up for it. So I think that, I mean, just from looking from my perspective, well, one, I think community-based services can kind of enable this type of a supervisor anyways. Like it becomes just that check-in. We've talked about before, supervisors maybe that you guys have had in the past or have been or don't ever want to be of that coffee, we call it like that coffee house check-in, right? Like, let's grab Starbucks, how are you? Cool, let me know if you need anything.
Yeah.
But I do think that this is an area that, in terms of scheduling, that we could even take a reassessment of for 2019 of like, are we overdoing it? Do we have too much? Are we trying to kind of like take on the world, and then it almost can lend us to accidentally slip into this? I think every person sitting at the table does not want to be this person, because we've all had this person, and you all speak against this person very, you know, like righteously. But yeah, I think like scheduling is the hard part, because we're like, yeah, we'll take on 5 more employees, and yeah, let's have 3,000 more clients. It's fine. And then
3,000.
oh,
Wow.
yeah. I made that
2019 is gonna be busy.
Right. But yeah, I think it's just easy to be like, yes, 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 and then we're like, oh wow, we're trying to review everything under the sun, and it's too much.
Yeah. And sometimes too, like I'll look at, you know, there's certain people that are newer or staff that are more difficult. So it's like, okay, I need to make sure I'm allocating the break times too. So even if you had, like, sometimes five cases might be, when people post that on Facebook, how many clients should you have? And it's like, well, it kind of depends on how demanding they are, right? Like, how much time are they really going to take for you? So you might have like 5 cases where everyone involved is on it and they're good, and you barely do have to give much feedback. But then you might have, you know, even that one case where it's like, oh my gosh, they're taking up so much of my time. But if you have 5 of those types of cases, then, you know, so kind of just reflecting on those types of things as well. So it could be that at certain points in your career as a BCBA, you feel super overwhelmed with only even having like 5 or 10 things going on your plate. And then sometimes you're flying with like 30 and you're like, I'm good, like everything's running smoothly and I'm good to go. So looking at that too, and it's always ebbing and flowing. Like I